Doing breast self-exam with confidence starts on the same day after your physician has informed you that your exam is normal. You'll want to start the exam process by reminding yourself to relax and that your breasts are normal. Your goal is to create a mental image of the normal. Visualize, don't analyze. Start the exam by focusing on one area of the breast. Use the pads of the middle 3 fingertips to make a 1-inch circle. Vary the pressure to maximize the normal texture. Concentrate and try to visualize the pattern, much like how a blind person would do to learn braille. Think of the concept of mowing the lawn without missing a blade of grass. The vertical strip method follows this basic pattern and is an easy way to get started. Most women seem to find it easier to go from the outer breast to the nipple in the outer half of the breast and use the vertical strip method to examine the inner half of the breast. Women should experiment and find the approach that is most comfortable. Whatever approach is used, the basic concept is to use the pads of the fingertips to make overlapping 1-inch circles covering the entire breast from the collarbone to the bra line and from the mid-chest to the armpit. Go over each breast completely, but do not expect to be confident after just one night. It typically takes several nights to gain the necessary level of confidence. Initially, spend 15 to 30 minutes, or for as long as you can keep your focus. Once you are confident, do it once per month. Menopausal women can choose any day of the month to do breast self-exam, but I tell my patients to start the year by circling day 1 of every month. Then when you do the exam, put an X over the circle. This approach promotes consistency in doing the exam and adds to a woman's confidence that she is following early detection guidelines. Menstruating women should do the exam 5 to 10 days after their period starts. Mark a calendar to ensure that you have established a permanent reminder to keep on track. Stop looking for lumps. It will only make you nervous. Once you know the normal and you do the exam on a regular basis, you will immediately recognize any important change. If you find a change, report it to your doctor. Remember that most of the changes you will find will not be cancer, but it is your doctor's responsibility to determine the nature of the change and whether or not it is cancerous. The doctor's evaluation of a self-examination change starts with a careful exam of both breasts, with a final focus on the area of the patient's concern. If the exam is normal, an ultrasound is performed on the area of concern. If the mammogram is not up to date, a diagnostic mammogram is ordered with special views of the area of concern. If it is concluded that the initial evaluation is unremarkable, the patient should return for a follow-up visit in 1 to 3 months, based on the patient's and physician's level of concern. Menstruating women should schedule their follow-up visit 5 to 10 days after the onset of their period. If symptoms are gone on a follow-up visit, the patient can return to a routine yearly follow-up. If a woman remains symptomatic, a diagnostic mammogram should be done if it has not already been performed. Even if the diagnostic mammogram is negative, tissue sampling by either needle or open biopsy must be considered, and also consideration should be given for having a breast MRI. If a woman remains concerned because of a persistent change and her doctor does not follow these basic steps, she should consider getting a second opinion. For more information, visit beawarefoundation.org/breast-MRI. Women must take responsibility for managing their health care. Breast self-examination is just one step that women can take to ensure early detection of breast cancer. Breast self-exam should be thought of as a layer of protection. Most early cancers can be best detected by screening mammography. However, women under 40 are not routinely screened. Breast self-exam is an important layer of protection in finding early breast cancers for this age group. Some cancers are not seen on mammograms, but can be detectable by self-exam, and self-exam is the most effective approach for detecting these interval cancers. For more information, please visit beawarefoundation.org.